Okay. So, hey, everybody, I'm Greg Gibson. I'm a wedding portrait and event photographer for the Washington, D.C. area. And this is the third in a series of live streams that I've been doing. I've been doing this to try to provide some real necessary information to photographers and other people working in the events industry whose businesses have been devastated by this COVID-19 pandemic. And guys, I've been so focused on guests and content and building this infrastructure to support this live stream, I haven't even really given this series a name yet. So I hope to have one really soon. And so maybe if some of you guys watching have an idea for a good name for this series, please post it in the comments. The first show we did was just a week ago. That one was on contracts and legalities as photographers and other people in our industry faced wave after wave of cancellations and postponements. The second show we did on this was with photographer Paul Giroux, and his project's called Portraits in the Time of Corona. So if you haven't seen those already, I hope you'll take the time to come back and take a look at those on my channel here. And speaking of my channel, I do want to ask a favor of everyone. If you found any of this information useful, please go to my YouTube channel, hit the subscribe button. This series of live streams has actually been my first attempts at broadcasting on YouTube, and I need to get at least 100 subscribers so that I can get a custom URL and hopefully make this this series much easier for you guys to find and to engage with us there. So hit subscribe, hit like, engage with us, leave some comments. That helps me, and it in turn provides more incentive for us to keep producing this content for you. So I can't tell you guys how excited I am about the show today and how honored I am to have this guest, a very prestigious guest who made time for us in his schedule. He's been very high demand. You've likely seen him making the rounds on various television news channels in the past week or so, as he's a very respected expert in the field of pandemics and influenza, as well as public policy. So he has a very unique perspective on this crisis. So I'm going to bring Dr. Parekh in. So I'm very pleased to welcome Dr. Anand Parekh, the Chief Medical Advisor at the Bipartisan Policy Center, onto today's program. In addition to being a board-certified internal medicine physician, Dr. Parekh is also the former Deputy Assistant Secretary of Health at HHS from 2008 to 2015. Dr. Parekh also recently authored a book called Prevention First, Policy Making for a Healthy America. And just by the way, I do have my own signed copy of that book. And if you check out this tiny postage stamp picture on the inside of the back cover, that's a little bit of my handiwork there.
Thank you, Greg.
So that was my leverage for getting Anand to join us today. So welcome, Anand. Thank you so much for taking the time to be here and share your perspective. Why don't you just tell us a little bit about the Bipartisan Policy Center and what your role is there?
Sure, Greg, and thank you for having me on. Happy to help however I can. So the Bipartisan Policy Center is a nonprofit organization founded 13 years ago by 4 former Senate Majority Leaders, 2 Democrats, 2 Republicans, to try to really find a space here in Washington, D.C. where all sides could come together to come up with policy solutions to some of our most complex challenges. So it's really a think tank, if you will, focusing on improving health, security, and opportunity for all Americans. And I serve there as the Chief Medical Advisor.
Great. Well, thanks again for being here. So let me set the stage for you just a little bit. Our audience here is primarily made up of small business owners and self-employed individuals, freelancers, contractors, 1099 employees. Many of them have seen their businesses devastated by this crisis, and many of them are unemployed for the foreseeable future and are very panicked and afraid, not only for their safety, but also for their livelihoods as well. So the people in the events industry, we are one of the hardest hit industries by this pandemic. So we're talking here to photographers, makeup artists, hairstylists, event planners, caterers, hotel staff, and so on. So I just want to give you a little bit of idea about the group of people that you're going to be talking to here. So we already know that many Americans live paycheck to paycheck, and our industry is certainly no different. One thing this crisis has highlighted is what a delicate balance we all exist in, and it's amazing the way a situation like this can snowball and so severely impact the balance so that it truly changes our entire method of social interaction. So, can you offer any words or advice to soothe these fears and give a little bit of hope to the future?
Well, Greg, this is a tremendous public health challenge. It's a very serious situation. But you're right. I think we need facts and not fear. We will absolutely get through this. Most of us have not seen something like this in our lifetimes. The last time there was a pandemic was a decade ago, 2009. That was an influenza pandemic, H1N1, but it was pretty mild. So I don't think most people recall any of us having to take these types of stringent measures. You really have to go back more than 50 years prior to that, 1968, when there was a moderate influenza pandemic. 1918, the Spanish flu is what people talk about in terms of a severe pandemic. So what we're experiencing right now is somewhat unprecedented in many of our lifetimes, but absolutely we will get through this. The situation we're in right now, I think, as most of you know, this is a pandemic, so this is a new virus. None of us have been exposed to, so we have no immunity. It can be transmitted from humans to humans in a very sustained manner, as we're seeing. What makes this very difficult is symptoms. A lot of these flu-like symptoms, fever, cough, shortness of breath. While those can indicate that you might have the virus, many people are asymptomatic. They don't have any symptoms, and they could be spreading the virus. So very, very challenging, and we'll get into that. Whenever you have a new virus like this, Greg, a vaccine is really what you want, because if you can vaccinate the public against this particular virus, then obviously people, many fewer people will get sick. Unfortunately, a vaccine is 12 to 18 months away. So everything we do now is really to buy time and mitigate the consequences of having a virus being transmitted, for which, again, we have no vaccine or we have no treatment. And so the primary mode of what we're trying to do, in addition to prepare the healthcare system, is what's called social distancing and community mitigation. And the reason we're doing that is if you have the virus unchecked and you just go about your normal daily life, on average, you will transmit the virus to 2 to 3 other individuals. We're trying to get that ratio down to 1 so we can reduce infection. So how do you do that? Well, you do that through social distancing interventions. You do that through canceling mass gatherings. You do that through school closures. You do that through working through telework. All of these things, Greg, essentially reduce the contact rate, and that's how you reduce new infections. This is a respiratory virus, so the way it's transmitted is essentially through droplets in your cough or in your sneeze that travel up to 6 feet and infect someone else. Sometimes that droplet could land on a surface, and then another individual touches that surface. They touch their mouth or their nose, and it can be transmitted that way. So it's really about social distancing. Now, I think the last introductory point I'll make is we know that social distancing has consequences. It has consequences for us personally, and Greg, as you mentioned, for our livelihood. And it's no small thing to ask small business owners and to stop doing what they're doing. And I think that's why there's so much focus right now on a bipartisan basis in Congress to really try to provide small business owners with the support they need, but also frontline employees and workers, whether it's paid leave, paid sick leave, or paid family leave, whether it's unemployment assistance, whether it's direct assistance, whether it's housing assistance, nutrition assistance. There is quite a bit that is coming down the pike, again, not fast enough and not perhaps to make people whole. And so this is the challenge that we're facing. It is a public health challenge. And again, I think we need to, if we can fix the public health piece and tackle the health crisis, the economic crisis, if you will eventually relent as well. But that is essentially, from a bigger picture, Greg, the situation we're in. It's a difficult situation, particularly for many small business owners and those who are working independently for a lot of the reasons that you mentioned.
Thank you, Anand. I just want to back up 1 second. I do want to mention that I'm going to bring Matt Mendelson on. Matt. So I just wanted to, I failed to introduce Matt before, and Matt's a good friend here, and I had him on to help me moderate and ask follow-up questions, because sometimes it's a bit difficult for me to pay attention to everything that's going on and run the feed as well. So I did just want to introduce Matt. But Anand, I'm going to come back to a couple of the issues that you just raised. One, I want to come back to the transmission, and also I want to come back to the stimulus package. But so with photography, it's fairly easy for us to do our jobs in an atmosphere of social distancing, really. Up close images are certainly, for photographers, a more intimate and revealing kind of way to work, but it's certainly possible for us to do our jobs and work with long lenses at a distance. On the other hand, there are many people in the audience here who are those that work in sort of more what I call the personal space area, like makeup artists, stylists, and others. So what advice do you have for them? And what advice do you have for those of us who do have to work to not only protect ourselves, but also to protect the people that we're working with? And another example I want to give you is press photographers and journalists. They've been deemed as essential. And so they are out doing their job, trying to gather information and inform the public. So what advice can you offer for those folks?
Right, Greg, it's an excellent question. And it is tricky, right? Because we know certain things. We are still learning every single day, every hour, more about the virus, how it's transmitted. But really, any type of social interaction within 6 feet of someone that you don't live with and isn't with you all the time. Unfortunately, given that there are likely asymptomatic carriers out there, there could be a potential of transmitting the virus. So as of now, what the science is telling us is that 6 feet interaction is critical. And washing your hands is the most important thing you can do. And that particularly is the case when after you have been in an environment with other people, perhaps touched common areas. Washing your hands for 20 seconds with soap. Alcohol, hand sanitizers are good as well, but nothing beats sort of washing your hands. Respiratory etiquette when you're around with other people. Sneezing, coughing, in a tissue, Kleenex, throwing that away, washing your hands, or if you don't have anything, in your elbow, but still, not the best there. If obviously you're not feeling well, isolating yourself. These are, Greg, the individual protective measures that everyone needs to take, in addition to the social distancing measures that we talked about in terms of 6 feet away. Environmental cleaning is also very important. You think about the equipment that many of you use, the areas where you work in. The latest evidence and research suggests that the virus can potentially stay on surfaces like metal and plastic for up to 72 hours. It can stay up to on cardboard for up to 24 hours. Now, again, lower likelihood. I mean, essentially somebody would have to cough or sneeze, and droplets would have to stay on that surface. Again, somebody would then have to touch that surface, touch their mouth or their nose, or their eyes. But still, these are possible transmissions, and so there are lots of different things that you have to be mindful of. And then, of course, there are the legalities. You have now close to 20 governors across the country that have put forward stay-home orders. Many are closed. Beyond that, have closed sort of non-essential businesses. And I think each state, defines sort of non-essential businesses a little bit differently. Of course, the White House has recommendations as well to avoid absolutely social gatherings, gatherings more than 10 people. But even those gatherings with fewer than 10 people, again, many states have gone well beyond. And it's just, Greg, a question of risk. So, the more people, the more environments, the closer the interaction just increases risk. And that's why individual protective measures and social distancing are so important.
Great. Thank you, Anand. So that said, many people in this industry do feel pressure to work, and they feel that pressure because they fear for their livelihoods. And so I think as a result, a lot of people are taking the situation maybe not as seriously as they should be. Or a lot of them feel that it's just been blown out of proportion by the media. So can you explain in very layman's terms why this virus is different from other forms of flu and why such extreme measures have been necessary to control the spread?
Yeah, there are three, I think, main reasons why this is different from seasonal influenza, which does also kill tens of thousands of Americans every year. We absolutely take it for granted. And hopefully a lot of what we learn, Greg, through this pandemic can help us year to year deal with seasonal influenza. But there are three really, I think, big differences. One is seasonal influenza is predictable. We know when it comes, roughly, and we know when it's going to relent. And we know right now that flu season is coming to an end. This coronavirus, a novel virus, is totally unpredictable. We don't have any history with this. We didn't even know that this particular strain existed up to 3 months ago. And because it is unpredictable, we don't know how long this could last, makes this very, very concerning. The second biggest difference is, of course, for influenza, we have a vaccine. And even though there's suboptimal uptake and only about half of Americans take the vaccine, and the vaccine isn't always perfect, it saves tens of thousands of lives every single year. We don't have a vaccine for this coronavirus strain. We won't have one for, again, 12 to 18 months. And then third, treatments. There are treatments for influenza if you're hospitalized, but also if you're not, and within 48 hours of symptoms, Tamiflu, you may have heard of, and others. Again, right now we have no treatment here as well. So no vaccine, no treatment, an unpredictable course, I think, is critical. And I think the last piece is, the mortality rate from seasonal flu is 0.1%. So about 1 in every 1,000 people who get the flu will die. And we don't quite know, again, what the mortality rate is of this particular strain. Again, we don't have a vaccine, we don't have a treatment. And likely there are thousands and thousands of cases, not just here in the United States, but around the world that have not been counted. But if you just looked at where we are right now, worldwide, there's a 4% mortality rate. In the United States, it's about 1.5%. Still many, many, many fold higher than seasonal flu. I mentioned that at the end, again, because those numbers will change and it will move. But it's probably not good to compare this to seasonal flu, because this is a very, very different set of circumstances in a different virus.
I'm going to jump in with Matt here just a second. He has a question. Go ahead, Matt.
So, Dr. Parekh, I have a question.
Sure.
About 15 minutes ago, a bunch of neighbors were all standing around singing happy birthday to one of our neighbors. We all stood on our lawns. And then we got into a discussion about food service, takeout food. Everybody, I sense, is starting to get a little bit itchy. It's a beautiful spring day here in Washington. People feel, I think, maybe, okay, now it's been enough time. Maybe I can do some takeout food. Can you talk about a little about what we should be looking for in food that is delivered or taken out from a restaurant? Should we not doing that at all? Should we do something, put it in the microwave? What?
Yeah, that's a great question. I think to be conservative here, trying to make as much food as you can at home, I think is the best way of going about it. Certainly, if you're consuming restaurant food, clearly not going to the restaurants is very, very important. I think in terms of take home and sort of drive through, there's always a concern of who is preparing the food, and could they be ill? Could they be even asymptomatic? Is there a way that then the virus could be transferred either in the plastic or cardboard where the food is, or somehow getting on the food and then you coming home and touching it? Matt, I think we're still learning a lot about this, and there's not a lot of great science, and it's all about sort of risk. The White House recommendations, 15 days to stop the spread, pretty explicit that you absolutely shouldn't be going to restaurants. Drive-through pickup might be okay, but a lot of governors have put restaurants, of course, in the non-essential business category. So many of them are closed, in fact. And so I think the best advice I can give is, to the extent possible, try to, cook the food at home from the groceries that you pick up from the grocery store. If you really feel like you have to, and there's no other choice than going to restaurants, or going to the drive-through, and the pickup, is your next best option when you come home. Just again, washing your hands at all times. If there's cardboard boxes, I think it's perfectly fine to wipe them down with a disinfectant. I think microwaving for your food, and I think all that is fine. But you to a certain point get to a space, Matt, where we just don't have a lot of evidence and data. So I think we all have to then sort of make the best judgment as we can. But again, washing hands, using disinfectants, try to minimize even the carry-out drive-through is probably the safest thing to do.
Thanks, Anand. Let me jump back to, I saw some reports last night, I think, that the U.S. now has the most confirmed cases of COVID-19 in the world, actually exceeding even China and Italy. And given that China's population is so much greater than ours, and they were pretty much ground zero with the earliest reported cases, have they managed at all to slow the transmission rate? And are we seeing a flattening of the curve anywhere, or any kind of decline anywhere that might seem to indicate that there's a bit of light at the end of the tunnel?
Well, Greg, I think in terms of China, the first month or so, a combination of them being sort of late to respond, and then a lack of transparency. The former hampered their response, the latter hampered everyone else's response. I think that was the focus point. And then in Wuhan and Hubei province, that's where really the number of cases exploded. What they then did afterwards is pretty unique to China in terms of the very, very stringent lockdown that they did, Greg, to really contain the virus. And we're talking really shutting absolutely everything down, where nobody really was on the street even. They had their military and very close sort of sight on the general public. And particularly in a country like China, and our country is different, some of the things that they were able to do is not what we are used to in sort of a democratic and free country like the United States. And so they were able to really crack down, Greg. And I think it's pretty difficult for other countries to do it to the same ferocity, if you will, that right. They were. But they were able to do it so well that it hasn't really exploded in other parts of China. Now, the concern here in the United States is our social distancing, lockdowns, stay home, call it what you will, shelter in place, has been much more sporadic, intermittent. Some parts of the country have them, some don't. And so right now, the concern, what you're seeing is twofold. One is, of course, New York City, where half the cases in the United States are right now, and the concern that is exploding like Wuhan. But the second concern, Greg, is that there are now multiple other areas around the country that are not, if they're not hotspots right now, they are warm spots. And this idea that in a couple of weeks, we may be in a situation unprecedented anywhere in the world where, China had Wuhan, Italy had Northern Italy. We may have multiple simultaneous hotspots because we haven't been able to do the social distancing enough and early enough that some of these other countries have been able to do. So imagine sort of a New York and a New Orleans and a Detroit and a Chicago and a Miami all at the same time exploding. I mean, right now it's hard enough to help New York City. Imagine the federal government, all levels of government, private sector trying to help multiple jurisdictions at the same time, and that is really the concern, and why I would argue that we need to double down on social distancing as a country. Whatever we can do, align with our norms and our values. We're not China, but there's still certainly a lot more we can do.
Let me bring Matt back in. He has another question.
I do. And along those lines, Doctor, you represent the Bipartisan Institute, but there was kind of a scathing piece in the New York Times this morning. I'm just going to quote from it a little bit. Rudderless, blindsided, lethargic, and uncoordinated, America has mishandled the COVID crisis to a substantially worse degree than what every health expert I've spoken with had feared. Quote, much worse, said Ron Klain, who coordinated the U.S. response to the West African Ebola outbreak, beyond any expectations we had. Where are we going wrong exactly? Why is this so difficult, where obviously it's difficult, but other countries like China and Italy have managed, at least in South Korea, to stabilize, and we seem to still be going straight up?
Yeah. So I think, Matt, in terms of the governmental response, it's been a tale of two responses. And I think the first response in sort of January and the first half of February, most of February, was a bet on containment. And that's the idea that we can keep the virus outside the United States of America. But Matt, microbes know no borders. And that was a bet that was made, and we lost that bet. And unfortunately, in that time, many of the things that we're doing now, I think many experts would agree that it would be good if we did a month ago. So whether it's testing, and there was a series of decisions made that put us back in terms of testing for a month, whether it's social distancing that we're doing now, which should have started several weeks ago to reduce the surge that our healthcare system is facing, or whether it's simply getting the masks and the respirators and the personal protective equipment for our healthcare workers and getting the critical medical material like ventilators deployed, staged, and ready to go. I think there's so much that is being done now. So you're seeing the second part of the response now, I think over the last 4 or 6 weeks. There's so much more intensity, so much more focus. A lot of good work ongoing, but it is work I think many feel that should have occurred at least a month ago. So we are playing catch up in all respects right now, whether it's testing, whether it's social distancing, whether it's supporting our healthcare system. And so that's why we find ourselves in the predicament right now, because we lost a lot of time in the first 6 weeks or so of 2020.
Great. Thanks, Anand. I want to, we're getting tight on time here, so I want to encourage everybody out there to ask questions. We don't have a lot of questions yet. I am seeing comments from Facebook and YouTube. So if you guys out there do have some questions, please send those in because we'd like to get those. I'd like to hit a few sort of maybe quick, short answer things because we are getting tight on time. One thing I would like you to comment on just a bit, though, on it is that one thing people in our industry were very excited to see was the massive aid bill that the Congress passed that actually took into account self-employed workers who were actually previously ineligible for unemployment. So what's your take on the scope of the aid package that was passed, and do you think that's enough?
Well, I think it's important. I don't think it's enough. I think all of these items, whether it's unemployment assistance, whether it's direct assistance, whether it's support for small business owners, whether it's paid leave, all of these things, I actually, Greg, look at them as public health interventions. Social distancing is hard. It's got economic consequences. It has consequences to our livelihood. The only way we can make social distancing realistic, practical and sustainable is if we introduce these policies to support Americans. And so I think this has to be done on a bipartisan basis. I think there have been a couple now. This will be the third package. Greg, I think there'll be a fourth, a fifth, a sixth, a seventh. So I think that Congress at the federal level, at the state level, I think there's gonna have to be more and more support because unfortunately, the social distancing, again, that's what we have right now. We're going to need to continue that if we're going to want to stay ahead of the virus and not be completely overwhelmed. And so if we have to continue with social distancing, we have to at the same time support the American public, workers, small business owners for however long it takes. But again, it's the public health response, and these kinds of things support that public health response, Greg.
Great. And I have just a couple more questions I did want to get to. So one question. So when we do have to venture out in public, obviously we need to go to the grocery store, we need to resupply. Do masks, latex gloves, hand sanitizer, does that all make a difference? Should people be wearing these things when it comes necessary to go out in public? I'm thinking particularly about shared surfaces that we have to come in contact so frequently, like those payment screens that we have to sign with our fingers, or the stylus on the credit card machine.
Ideally, wearing masks and gloves, could be helpful. The challenge, Greg, is that we have a tremendous shortage of these personal protective equipment for the frontline healthcare workers right now all across America who are responding to the pandemic. And so in an ideal world, and particularly with the virus that can be transmitted asymptomatically, lives on surfaces, yes, a mask could be helpful. Gloves could be helpful. Unfortunately, there are tremendous shortages in this country. We can't even get enough for the healthcare workers who are caring for patients where we know for sure they absolutely need it. And that's the big challenge, Greg. And so I think, again, washing your hands as much as possible is critical. The alcohol-based sanitizers are helpful if you're not in a position to wash your hands. But I think doing that as much as you can, practicing respiratory etiquette, make sure to remind others to do that is important. If at all you're symptomatic, not being out, not going out, all of those things are really important. And again, when you venture out, because you will have to, whether it's to the pharmacy or to a healthcare provider or to the grocery store or to the bank, just being mindful of all of these things, the social distancing, the sort of the 6 feet away, all of those things I think are pretty critical.
So let me ask you this question. Let's say somebody does get into sort of a worst case scenario situation and they have a family member test positive. In fact, I think I mentioned this to you already. I have a relative who tested positive along with 2 of her children, yet her husband, who actually was the one who was symptomatic, tested negative. So obviously they're in self-quarantine, But how can we manage a situation inside our homes where maybe one person becomes infected while others are not?
Yeah, it's difficult, but I think the best you can probably do is try to, particularly if you have more than one room in the house, is try to isolate that individual so they have their own room, they have their own bathroom, because toiletries, even touching them, you can transmit the virus. Have their own eating utensils and plates. But as much as possible, trying to isolate that individual from others. And again, it's easier said than done. Frankly, in Wuhan, China, and other places, they were trying for cases, they were often trying to isolate individuals outside of the home setting, just because it's so easy to transmit it within the home setting. So, ideally, and we're not there, but I think particularly one idea for healthcare workers who are on the front lines, who may be exposed. One idea has been, is there somewhere else they can be, a hotel or somewhere for a while until they recover, as opposed to sort of going home. But for those families who are in a home where one person has the virus, again, Greg, whatever you can do to separate, isolate that individual is going to be critical. And then no one really should be leaving the house for the next up to 14 days, because again, you could be an asymptomatic carrier and not know it.
So where do we sort of draw the line on the social distancing versus the social isolation, Anand? Are we okay to walk our dogs? Are we okay to go for a jog in our neighborhood? Where do we draw the line there?
Yeah, just be mindful. I think we can't become isolated. Well, we need the fresh air. I think going for a walk, a run, I think all of this stuff is really important. Again, if it's members of your own family that you live with, you're with 24/7. Certainly doing this together is fine. It's just that if it's someone else who you either don't know or don't live with, you want to maintain that 6 feet distance, because that's how the virus can be transmitted. Again, even if individuals don't think they're symptomatic, it could be the offhand cough or the offhand sneeze. So again, just when you're outside the house, maintaining that social distance is absolutely critical.
So I'm trying to get to the end here. We're very close to wrapping this up. So I do have a question. What about the elderly? Is it okay to go for a walk with an elderly relative or a neighbor? I think about my 77-year-old mother-in-law who lives alone, and her social activity circle revolves around group activities with her church. So I sometimes wonder if maybe this social isolation can be almost as bad as the virus itself.
Well, social isolation itself, you're absolutely right, is a public health challenge. I think it's important to make this point clear that the vast majority of individuals in the United States and worldwide who have died from COVID-19 have been individuals who are elderly, as well as who have severe chronic conditions. That being said, if you're not in that category, as data from the Centers for Disease Control and Prevention has shown, you can still get sick enough to be hospitalized, sometimes in severe cases. You may not die, but this is a virus that is really affecting all populations, even though there is an at-risk population, particularly dying from the virus. But I think when it comes to someone elderly, it's even more important that they are able to maintain that social distance. The individual protective measures are important. If it is a family member or somebody who's elderly who you don't live with, and you want to take them out for a walk, it's fine, but do it cautiously. Again, 6 feet, social distance. Make sure that they don't fall. If they're, so there are other things you need to think about as well. But we have to be really, really cautious, particularly with this population.
So Dr. Vlad here is asking, does the amount of virus exposure make a difference? For example, can you pick up a relatively if you picked up a relatively small amount, will you be less sick than if somebody coughed directly in your face?
Yeah, again, we're still learning a lot about the virus. The data suggests that to a certain extent, whether you show symptoms or not, you may be able to transmit the virus as effectively. You're right. Some people may have at a particular point a low level of virus, and that makes it more difficult to transmit. Some people are actually, and this is concerning, are getting tested and are testing negative, but it's actually a false negative. So how you get tested on that particular day, the specimen, the swab, are all sort of factors. And so again, Greg, I think we're learning a lot every day, but it absolutely does appear that you can spread the virus even though you don't have a lot of symptoms, and the amount of virus that you have can affect whether you read positive or negative, or how likely it is you are to transmit to others.
So I'm just going to throw up this question here from Mark Amels, and this is sort of the common theme that I'm seeing in some of the comments here. We kind of know where we are right now in the short term. It looks like the social distancing and the staying at home is going to stay in place, and probably the closure of non-essential businesses. But so let's say we come out of this sometime in the next few months. Are we just going to be back here? Because I hear that possibly warm weather can depress the transmission. So are we just going to be right back here again come November, December?
The truthful answer is we just don't know. When you look at past pandemics, several of them have had multiple waves. And so the question is, well, why do pandemics have waves? Why do they come and go? One could be weather, seasonality, like you just mentioned. A second could be the virus could mutate a little bit. We haven't seen a lot of evidence of that so far. A third could just simply be human behavior, how we're responding to the virus. So it could very well be that we do the social distancing for several months and then we let up, only to have the virus come back again, because we don't have any herd natural immunity. We don't have a vaccine yet. We're going to learn a lot, I think, over the next couple of months, because China, South Korea, many countries are a couple of months ahead of us, and they're, particularly China, at the point where they have started to now loosen some of the restrictions. So we're going to see essentially what happens in that situation. I think that's going to be pretty instructive for the United States. When we let up with social distancing, will the virus just emerge again? But the issue of seasonality, Dr. Tony Fauci, who's the national expert, has suggested that there could be an element of seasonality here, where it goes away in the summer months only to come back in the fall or the winter. And there, again, we're going to have the same type of situation where we're going to have to hunker down with social distancing, because it could be even more significant pandemic at that time. All the more reason why we need to prepare our healthcare system and figure out how we adapt to sort of the social distancing environment.
Great. Well, thank you, Anand. So last question here, and I'm going to get you out of here on this. So if you could pull out your crystal ball and take a look a year from now, what kind of lasting impact do you think this crisis is going to leave on our society?
Well, Greg, I think, unfortunately, a lot of Americans will die from COVID-19, and we just don't know how many. And that is tough to say and tough to think about. We just reached 1,000 Americans yesterday, which is a milestone. As you said, we're already number one in the world in terms of cases. I hope in a year we'll have a vaccine, and I hope vaccine will be in people's arms. And I hope by that time we'll have treatments as well. I hope we'll have found that sort of happy medium between, that happy medium between both sort of social distancing and also sort of us living our lives. But I think it is going to be a difficult year. Less concerned about our economy and livelihood long term. That will again come back. That is based on the public health challenge we're facing now. So all of that will come back. It's just the people we will lose in the next year. I think is going to be difficult for a lot of us, for all of us, really.
Well, Anand, I really appreciate you taking the time to join us here. I'm sorry we ran over time a little bit, but I think that your words are going to have a lot of impact on many people out there. And I thank you so much. And whenever the coast is clear, you have a free family portrait coming from me. So I will come out and take care of you guys. So thank you again. And I look forward to the time that I can actually see you in person again.
Greg, thanks so much. Everybody just stay safe, stay home.
So I'm going to let Anand drop off, and I have just a couple of things. I'm going to show them the BPC website with your top 10 things to know about COVID-19.
Great.
So I'm going to let you drop off,
Great.
Anand, and thank you so much.
Great. Thank you.
So guys, just a couple of things here. The Bipartisan Policy Center, who Anand works for, has a really nice website here. It's bipartisanpolicy.org is the URL, and they have a great site here called the top 10 things that you need to know about COVID-19, and that has some really good information on it. So you guys can take a look at that. Let me just reload here. Also, the photography organizations have been very proactive in getting information about COVID-19 out and about how to protect yourself and things that you need to know. I think the National Press Photographers Association has been really proactive about that. So you can use these links here. ASMP has some good information, and I believe ASMP is going to have a town hall meeting tonight, a live stream town hall meeting tonight about this issue. So I would highly encourage you guys to check in on that. Professional Photographers of America has a really nice site. One of the things that the PPA site has is sort of a rundown on the government initiatives that are available to us. So that's a very good resource. NPPA just held a town hall meeting Wednesday night for their members where they kind of brought in a bunch of working news photographers from around the country and different newsrooms and management, and they talked about some ways that they've modified their news coverage. They're adhering to social distancing. A lot of the TV folks talked about how they're no longer using lavalier mics. They're actually using shotgun mics and boom mics, and they're finding ways to conduct their interviews and do their news gathering in some very in new ways, in ways that they haven't used in a long time. So they're doing interviews through glass doors and by phone or even in text messages. So there are folks out there that do have to work. News photographers have been deemed essential. And so they are out there trying to cover the story and keep us all informed. And so we appreciate the efforts that those folks have. Certainly some of those folks have some fears about doing their job. And I just want them to know that we certainly appreciate the efforts that they make. So Matt, I'm going to jump over to you here real quick. Do you have anything you want to add here in closing?
No, I think the funny thing is that the word bipartisan hung over Dr. Parekh's shoulder that whole interview. And of course, right now, what we're seeing is this entire crisis devolve into a non-bipartisan squabble between Governor Cuomo and the president. I think that's really unfortunate. You think back to what happened in World War II, and there was a spirit of bipartisanship, and that's a bummer. Of course, it's beyond a bummer that this has gone the way it's gone. But I think he offered some great tips, and I look forward to the day when we can say this is a partisan effort.
Well, thanks for being here. Thanks for being my support. I appreciate everybody tuning in. I hope I got to the questions that people wanted answers to, and I think Dr. Parekh gave us some great information moving forward. So thanks for tuning in, guys, and we'll see you on the next one.